Today we're covering highest yield bored pearls in veterinary toxicology. These are the clues that should immediately trigger a diagnosis in your mind. If you see sudden death or cardiac arrhythmias, think oleander, yew, or menincin. If an animal is having sudden violent seizures, especially near wetlands or water sources, think water hemlock. If a grazing animal starts acting strange, depressed, uncoordinated, or just plain weird, think locoweed. The name is your clue. The animals literally act loco. Here's a classic horse question. The horse wants to eat, approaches the feed normally, but can't chew or swallow. That's chewing disease caused by yellow star thistle or Russian knapweed. Now let's talk blood colors. Chocolate brown blood is one of the easiest toxicology clues in all of veterinary medicine. That's nitrate or nitrite toxicity until proven otherwise. Bright red blood is the opposite clue. Think cyanide poisoning, especially from Johnson grass or choke cherry. For horses, dark brown urine plus anemia should immediately make you think red maple toxicity. When the history mentions contaminated hay and chronic progressive liver disease, think pyrrolizidine alkaloid poisoning from plants like tansy ragwort, groundsel, or crotalaria. If a horse develops acute laminitis shortly after moving into a stall with fresh bedding, think black walnut. Fall pasture, muscle weakness, and pigmenturia in a horse, think box elder maple and atypical myopathy. If sunlight suddenly seems to be causing skin damage, think St. John's wort and photosensitization. When a horse is drooling excessively but otherwise looks pretty normal, think slobber syndrome caused by slaframine. Acorns plus kidney disease? Think oak toxicity. A goat that's suddenly drooling after chewing on landscaping plants should make you think azalea or rhododendron exposure. An overdue mare that isn't producing milk is classic for tall fescue toxicosis. Cracked hooves and hair loss in western livestock should make selenium toxicity jump to mind. A horse that accidentally gains access to cattle feed should immediately make you worry about menincin toxicity. And two teratogenic classics. A one-eyed lamb points to false hellebore, while crooked calf disease points to lupine exposure during pregnancy. Here's the key takeaway. Board questions often hide the diagnosis in one memorable clue. Learn the clue, and you'll often know the answer before you've even finished reading the question. Like, subscribe, and share if this was helpful.